Hey everybody, this is Dr. Jones with Colorado Medical, and if you're watching this video, you're probably one of our hormone patients or one of our weight loss patients. And so the goal for today's webinar is to educate you on the ketogenic diet, because I know this is not the first time you've heard about it, and we are recommending the ketogenic diet because it's very powerful and effective strategy for not only helping you with weight loss, but actually making you healthier, believe it or not. So let's go ahead and get into it, folks. So chronic stress will increase stress hormones, that'll raise your blood sugar, and that'll cause insulin resistance. Now, insulin resistance is when your body begins to not respond to insulin as well as it used to. And insulin resistance is one of the first things that happens on the path towards diabetes. And so we are finding, and you may have heard of a condition called metabolic syndrome. Insulin resistance, metabolic syndrome are almost kind of saying the same thing, but it is where your body is having these health issues develop from too much sugar, too much inflammation. So you have that unstable blood sugar. The liver starts to break down certain proteins. You're getting hungrier all the time. You only get satiated and feel full when you're eating sugar. It's a broken pathway in your body. Ketones, which are what might be produced when you're eating a high-fat diet. When we say might, we're going to get into that during today's webinar. It's clean energy. It turns off protein digestion. There's no insulin released when you're eating fat. And so, guess what, folks? How do you reverse insulin resistance? How do you reverse the condition that's the result of too much insulin? You get less insulin. How do you get less insulin? You stop eating the things that cause insulin secretion, carbohydrates, and protein. And guess what that leaves you with, folks? That leaves you with fat. The ketogenic diet mimics fasting. So hopefully you've already watched the fasting webinar, or you are going to watch that next, because we usually have our patients watch both. But believe it or not, if you're not fasting, the ketogenic diet mimics the fasting. Not from the cellular autophagic response, which you'll learn about that in the fasting, but it mimics it in terms of so many other processes that happen during fasting. One of them is the fact that you are burning more fat and you're regaining your body's ability to burn fat. That happens in a ketogenic diet and fasting as well. Ketones are going to be produced from the stored body fat that you have. Very low carbohydrate intake, high fat, and moderate protein. That's the key to not only your weight loss goals, but ideal health. And eventually, when you get healthier, you can have carbohydrates. A concept called carbohydrate cycling, which we'll talk about that in a later webinar. So fat burning is obviously the key behind the ketogenic diet. Is you are teaching your body how to burn body fat, an ability that you have probably lost because you've been eating so much processed carbohydrates and your body's inflamed and it's unhealthy. Another amazing perk of being on the ketogenic diet is mental focus and clarity. Your body functions more optimally off of ketones. It's a cleaner fuel. What does that mean? Literally, your body produces more free radicals, it produces more bad stuff when it has to process carbohydrates for energy than it does when it has to process ketones. So listen to that. You produce more bad byproducts from carbohydrate metabolism than you do from ketone metabolism. It's a cleaner fuel source. They literally, even recognized by the medical community, and it's a big deal when it's recognized by the medical community, treat neurological diseases in children by putting them on a ketogenic diet. That's how much cleaner being on a ketogenic diet is. You're less hungry. That's huge, because it's those hunger cravings that lead to erratic eating patterns that make it difficult to lose weight. And when you're on a ketogenic diet and your body's producing ketones, you actually get reduced hunger cravings. In the beginning, it won't feel like that, but when you adapt and you actually start producing ketones, you'll notice that effect too. It's got anti-cancerous benefits because cancer cells run off of sugar. And so if you're on a ketogenic diet, you're not eating sugar. You're going to maintain and increase strength. That's another amazing thing, because if you are looking to build muscle mass and build strength, You might expect to lose some of that on a traditional diet where you reduce your calories, because you got to reduce your calories and exercise more to lose weight. But when you're on a ketogenic diet, you are actually preserving the muscle mass on your body a lot more efficiently than the exact same amount of calories and exercise, but eating carbohydrates. It's anti-inflammatory, we talked about that. It's a cleaner fuel source. So brain function and mental clarity. I personally do what's called a cyclic ketogenic diet, which we're going to talk about, where I cycle through periods of ketosis because it's of all the benefits that I get from it. The mental boosting effect. It's similar to fasting. That's why they work really, really well together. Less free radicals, and it actually changes the way our DNA is expressed. So ketogenic diet is getting a lot of attention. Treatments for neurological diseases is one of the big things. Increased BDNF, brain-derived neurotropic factor. You get that from fasting too. That is your brain's focus hormone. That is what causes you to have better attention span, better focus, better clarity. You get it after ketogenic diets that where your ketone levels get high enough, and you get it from extended fasting too as well. So beta hydroxybutyrate is one of the main ketones that are produced by your body. And so this is from Dr. David Perlmutter, which has wrote many books on the topic of ketogenic diets, and he treats his patients off of using extended ketogenic diets. But beta hydroxybutyrate is also an epigenetic player. It actually has huge effects on the expression of your DNA. When you're in mild ketosis and your body is availing itself now of this chemical beta hydroxybutyrate, it stimulates changes in the expression of your DNA. That's just a very complicated way of saying that your body will literally function better down to your DNA when you spend more time in a ketogenic state. So the mechanism, you have to understand these mechanisms. So low glucose and low glycogen causes the breakdown of fat into ketones. So when you stop eating carbohydrates, your liver has to deplete. It takes about 3 to 4 days to deplete all of your glycogen. Glycogen is essentially what happens. You eat sugar, it gets stored as glycogen, it gets stored in your liver, and it gets stored in your muscles. When you start doing a ketogenic diet and you eliminate all the carbohydrates, it takes about 3 days to burn up all your liver's glycogen, and then your body starts breaking down the fat tissue and starts producing ketones. This is the ideal breakdown of your macronutrients if you really want to hit a ketogenic state. About 5 to 10% of your calories should come from carbohydrates, 70 to 80 from fat, and 15 to 20% protein. Less protein than you might have thought you needed to really benefit from a ketogenic diet. Minimizing the carbohydrates is obviously the key in replacing them with healthy fats and moderate proteins. Those healthy fats, that's organic coconut oils, organic olive oils and avocado oils, all of your meat coming from grass-fed, free-range, non-pasteurized eggs if possible, or at least organic eggs, will make up the healthy sources of saturated fat. And then you also want to get the healthy sources of monosaturated fat, which come from your avocado oil and your olive oils, which you really shouldn't cook with those oils. So I always stress to our patients to make your own dressings. It's not that hard, and incorporate a good quality olive oil into your dressings. And here's a slide that kind of goes over these examples of what are good sources to include in your ketogenic lifestyle. And obviously we want to avoid the sugars, the grains, the fruits, even fruits, believe it or not. You can have a couple strawberries, a couple berries. Those are okay because while they're sweet, they're actually low in sugar. But we really want to avoid the bananas, the grapes, and the watermelon, and all those more sugary fruits. Legumes, anything that has carbohydrates, except for fiber. Fiber's okay. So you take the total carbohydrates, you minus the fiber, and you're okay. So these are just some sample meals. You can reach out to our office and we can email those to you folks. It's not a problem at all. But this just kind of gives you an idea of what being on a ketogenic diet looks like. Some sample snacks. So the Western culture, how many of you have eaten anything on this list, on this picture here in the today? How about the last couple days? If you're watching this video, you're one of our patients and you're doing a service like natural hormone therapy to regain your life back. So we really need to start confronting the reality of what we're putting in our body and how our body is what we eat, and we're not going to regain our health unless we start making those changes. It takes practice in order to become ketogenic. In fact, a lot of our patients, it could take a whole month. I might prescribe for you to go on the ketogenic diet for an entire month, because it's going to take that long before you actually start producing ketones, because your body's so inefficient at burning fat. But intermittent fasting is going to help accelerate that, and of course your diet. Those are the keys. So cycling mild ketosis compared to continuous. In the beginning, chances are you're unhealthy, you're overweight, you're inflamed. Don't worry about cycling right now. Get on the ketogenic diet. We're going to talk about how you can measure that in a second. Get into ketosis and do your best to stay there for about a month. And then come talk to us, because we will help you kind of navigate from there. But basically, it is the ability to burn body fat is what you are retraining your body to do, because your body runs off fat or it runs off carbohydrates in many different forms. And ideally, optimal health means your body can cycle an ability called metabolic flexibility, but we have become metabolically inflexible because we process crap and we're inflamed and we're unhealthy. So only after you've been in ketosis for a month can you then begin to introduce healthy carbohydrates in a cyclic fashion, which is what we call cyclic ketogenic diet. So 3 to 6 weeks, I like to see a month. And then after that, we can do a day of carbohydrates per week for a couple months. And then maybe you can start implementing carbohydrates on the days that you lift weights. Hopefully you're lifting weights, because every man and woman, regardless of your age, needs to be doing some form of resistance training for optimal health. It has literally been proving through research that the more muscle mass you have, the more healthier you are, the longer you will live. It's correlated with better all-cause mortality. So look out for more webinars later about weightlifting. Many hospitals and different medical institutions utilize ketogenic diets. It's very powerful. So implementation, again, is key. You got to understand the basics. Fat has 9 calories per gram. Carbohydrates and protein have 4 calories per gram. So you really got to be strict during these first couple weeks, reading labels, figuring out and really figuring out what you're consuming. You take this label, for example, you look at the carbohydrates, 4, you minus 0 fiber. So this has 4 grams of carbohydrates per serving. And so 4 carbohydrates is okay, but your goal is to get under 50, and really your goal should be to get under 30, get as close to 0 as possible, because some of you are going to find through trial and error that you're actually not going to be able to get in ketosis because your body is so unhealthy. And that's where you can reach out to us for more help. Signs that you're in ketosis for the first time: you'll have this keto breath. It's because of an increased production of acetone. Interesting is the best way to call it. It's bad breath. You'll start noticing that you got more mental clarity. You're more focused. You start losing weight, and a lot of that's fat, but a lot of it's water weight too initially. So carbohydrate, your body holds on to water when it stores those carbohydrates. So you're going to be measuring your ketones. We're going to talk about that. And so anywhere between 0.5 to 3 means you're in ketosis. You start noticing that your appetite's suppressed better. You have an increase in energy and focus. So full-on ketosis, believe it or not, a chicken breast is going to, by itself, is going to kick you out of ketosis. Test it out for yourself and you'll see. But having a chicken breast that is paired with avocado, for example, is actually going to be significantly better for you because there's a lot of fat with that protein, which slows down the digestive process, causes decreased insulin responses, which keeps you in ketosis. Just keep in mind that whole avocado does add a lot of calories too as well, and you got to be thinking about your calories if your goal is weight loss. So if your goal is weight loss and you don't have that many calories to play with, maybe eat half a chicken breast with half an avocado, for example. So A common way to test whether you're in ketosis is these urine strips. I don't like these urine strips. They're not too accurate in my opinion. What I recommend for all my patients is you can go to Rite Aid or you can go to Amazon and you can pick up a basic blood glucose ketone monitor. It's the same little machine that diabetics use. It's like $100 to get a good one. You can go on Amazon or you can go on a Rite Aid, get that. And in that first month or so, you're going to be testing various foods to see if it kicks you out of ketosis once you're in there. And really, you're going to be testing yourself just to see how long it takes you to get into ketosis. And the longer it takes, the more unhealthy you are. So what I like to do in the morning is I like to have a nice cup of high quality organic coffee that I brew myself. And depending on my goals, if I'm in a weight loss program or a fat loss program, I should say, it's going to be straight black coffee. If I am maintaining or maybe trying to put on some muscle mass, I might be increasing my intake of calories, so I might put some MCT oil or some coconut oil. This is kind of what I look like in the morning. I like the stevia is completely fine, so you can have coffee, you can have stevia, and that doesn't break your fasting either. Fat will break your fasting. So depending on your goals, I put this here, but it's important to understand that if your goal is weight loss, I probably have you on an intermittent fasting regimen, and I probably told you to skip breakfast. So keep in mind that black coffee and stevia is probably what you're going to be having, but if you want coffee or tea later, you can blend tea with coconut oil or butter or organic heavy whipping cream as well, and have a nice tasty kind of frothy alternative to that crap from Starbucks. So ketone esters, you might have heard of these products and you're wondering if I recommend them. I really don't. I think it's a bit of a waste of money. I don't think it's a scam, because if you take these ketones, so what these products are is they're actual ketones. So of course, if you ingest them and you test yourself, you're going to have ketones in your blood. But they weren't ketones that your body produced. And the whole point of going in a ketogenic diet is to retrain your body how to burn fat, which means produce its own ketones. The only time I recommend ketones is if you are somebody, probably a reactive hypoglycemic, which AKA if you don't eat, you get very irritable, your blood sugar is all over the place. This is the give me a Snickers bar, or I get very hangry, which is very unhealthy. It means you can't control your blood sugar. And so the only way to get better is to fast and eat fat, which is again the issue that these reactive hypoglycemics struggle with. So in those cases, I will prescribe some ketones so that the patient can give them fuel that is still allowing them to train their body to burn fat, which any other fuel source, carbohydrates, negates the purpose of why we're trying to cut carbohydrates to begin with, which is why they're a reactive hypoglycemic to begin with. So some side effects to look out for if it's your first time, the keto flu. The keto flu, it's a transitional period where your body is learning how to deal with these ketones. Your body's got to adapt, and it will adapt. You might be tired, lethargic. You might even have some headaches. Three primary reasons for this is an electrolyte deficiency. So it's not just drink more water, which is always important, but make sure you're getting enough electrolytes. And so sodium, potassium, magnesium, you can get a nice mineral salt. Pink Himalayan salt, believe it or not, is not that rich in minerals, and they've kind of fooled everybody to think that. Celtic salt is the key that actually is chock full of minerals, and you can sprinkle a little pinch in your jar of water. I say jar because hopefully you're not carrying around plastic bottles because of how bad those are. If you're on certain medications like blood pressure medications, please consult with one of your physicians about embarking on this program. This is not medical advice at all, and you'll need to consult with your physician. So if you're working with us, we're probably already looking at your blood markers. We can catch and potentially see some issues that might arise. Some people think, oh great, I can eat a bunch of cheese and dairy and that might help you lose weight, but that's not ideal. You got to understand that you got to be eating clean, organic, grain-free, grass-fed sources of meats and organic, high-quality dairy too as well. Otherwise, you may run into some issues that are going to check your blood markers. They're going to affect your blood markers. So healthy cells versus cancer cells. Healthy cells are metabolically flexible. They can switch from glucose as an energy source or fat. Cancer cells cannot They can only run off glucose, which is why this is literally how I would tell a person to eat if they had cancer. I would literally put them on a ketogenic diet and maybe decrease their meat intake a little bit. If you are over 40 and you don't smoke, there's an 80% chance you'll die from one of 4 diseases: heart disease, cerebrovascular diseases, cancer, or neurodegenerative diseases. Dr. Peter Attia is an ultra endurance athlete, and we get a lot of his, follow a lot of his protocols. And he's been in clinical ketosis for 3 years. As a physician, he likes to do these experiments on his own. We don't recommend anybody staying in ketosis for that long. Even if you feel great, I think that you can develop problems with that. But if you're treating a disease, of course, stay in ketogenic diet. That would be the only time I'd recommend staying in a ketogenic diet for that long. Calorie restriction in restricted ketogenic diets with reduced circulating glucose levels, which you obviously will have that when you're in a ketogenic diet, will elevate ketone levels. It's anti-inflammatory, it's anti-angiogenic. It's going to reduce the potential growth of these cancers. Very, very, very powerful intervention for cancer patients. Carbs and glucose feed all your cells. Cut the carbs, decrease the glucose, and starve the cancer cells. And that's what can happen. Okay, thank you guys so much. Once again, if you have any questions, you can always reach out to us. If you are looking to get more help with weight loss, utilizing ketogenic diets and fasting, or more importantly, let's say you are on our hormone program, you're implementing the ketogenic diet and fasting, and you're still unable to lose weight, it's important to pay attention to this. You have probably some gut dysbiosis issue, whether it's small intestinal bacterial overgrowth, whether it's leaky gut syndrome, whatever it is, we can help you figure out what it is. Give the office a call, schedule a consultation with me, and we'll help you figure out what's going on and help you with your weight loss goals. Thank you so much.